Well, frontline nurses are picketing outside public hospitals across New South Wales in a 24-hour strike, demanding a bigger pay rise and nurse-to-patient ratios. They say the Premier isn't listening and their only option is to escalate industrial action.
Not happy, Dom! Not happy, Dom!
Thousands of overworked New South Wales nurses and midwives walk off the job in protest for the fourth time this year. They want a 7% pay rise, matching inflation.
We're simply asking for ratios, so fair patient ratios, so keep patients safe, and also a fair pay rise in line with inflation to reflect the work that we've done over the pandemic. We've been quoted as the heroes of this pandemic, and we'd like to see that we are rewarded appropriately, but mainly the ratios. We want our patients to be safe. We want our staff to come back and work.
But more than that, they want the state government to address what they say are unsafe staffing levels in public hospitals. They want a minimum of one nurse to every 4 patients in wards, something they insist both the coalition government and Labor have had little time for.
We believe that nothing's being done, nothing's changed, it's just getting worse.
The nurses and midwives here at Westmead Hospital are in for the long haul. They're staying here for 24 hours straight, and this is just one location of 60 across the entire state. Some have even brought their sleeping bags in the hope that the state government will listen to their demands this time. They expect 2,000 Western Sydney nurses to join the picket line at Westmead on and off over the 24 hours. The nurses here are angry.
My concerns are for the safety of our patients and also the safety of our staff. To practice properly with the correct ratios would lessen the errors that get made.
We've put our pay offer to the unions across the public service, and that's at 3% for this year and 3.5% next year. That is the leading policy in the country when it comes to wages. I think only Queensland matches that.
The New South Wales Nurses and Midwives Association assure critical care at hospitals will be maintained, but surgeries will be delayed as a result of the strike action. Kenny Heatley, Sky News, Sydney.